performing a head-to-toe assessment, okay, the first thing I would do is wash my hands, walk into the room, wash my hands, introduce myself to the patient, identify the patient, make sure it's the patient that I'm supposed to be seeing, check on armbands, ask them to repeat their name and their date of birth. I'll identify my patient and then I'll explain the procedure. Okay, first thing we're going to be assessing would be the head. So I'm gonna go ahead and verbalize the palpable fissures, which are the eyes. You would look at this, especially in babies, to make sure that there's no congenital diseases, and the actual angle of the eye when it's open, and the nasolabial fold, which would be right above the lip, would be the fold right over here. Okay. Then I'm going to go ahead and palpate the head and the scalp. I'm going to make sure that it's smooth, there's no bumps. Okay. I'm going to palpate the temporal arteries. Okay, and then I'm going to palpate the temporal mandibular joints. If you could open your mouth for me. Thank you. Close it. Thank you so much. Okay, and if you could please clench your teeth for me. Smile. Puff. Go again. And squeeze eyes tightly. Squeeze your eyes tightly. And also wrinkle your forehead. Okay, we're going to be that's to check the cranial nerve number 7. Now I'm going to go ahead and check the extraocular movement. So if you could follow my finger. Very good. Okay, and I'm going to do visual fields by confrontation. Okay, if you could cover one of your eyes for me. Okay, and tell me when you see my finger. No, just look straight at me and tell me when you see my finger.
I see your finger.
You could just tell me now.
Oh, I see your finger. With my peripheral vision?
Very good.
I see it.
Okay.
I see it. I see it. I see it.
Okay, now the other eye.
I see it. I see it. I see it. I see it. Yep.
Okay. Okay, now I'm going to check the pupillary response. At this point, I'm going to dim the lights. Stay right there. Okay, look straight ahead. And I'm going to check both eyes. Okay. Very good. They're both, pupils are equal rounds reactive to light with accommodation. And it would be 3 mm brisk. Okay, now I'm going to go ahead and inspect the ear. Okay, I'm going to go ahead and, I'm going to inspect the ear, make sure there's no discolorations, no bumps. Then I'm going to go ahead and lift up the pinna and I'm going to press down on the tragus. Ask, is there any pain?
No.
And then go ahead on the mastoid. Any pain?
No.
Okay, that will just detect if there's any mastoiditis. Okay, and then I'm going to go ahead and perform an external nose inspection and palpation. I'm going to see if there's any any lesions, if it's symmetrical, which it is, and then I'm going to go ahead and check for patency. So I'm going to cover one of your nostrils and go ahead and breathe. Very good. Very good. Okay. Now I'm going to inspect the lips, the tongue. We don't have a tongue depressor, but we'll be improvising. Okay. Okay, if you could open your mouth for me. Stick out your tongue. Lift up your tongue. Very good. And I'm going to go ahead and depress your tongue. Okay. Very good. And now if you could please try moving, like pushing your tongue, your cheek with your tongue, go like this. Very good. Okay. Now I'm gonna go ahead and identify the thyroid. And and palpate it. And during this time, I'm also going to be checking the palpable nodes. Okay. I'm going to go ahead and closer. Okay. If you can lift up your, okay, and put your head up a little bit to the front. Okay, very good. Okay, I'm going to identify the carotid first, which is right here. Okay, and then I'm going to ask you to swallow. Okay. Very good. So it'll be right here, thyroid gland. It's not enlarged. It's not enlarged. Okay, and I'm going to go ahead and palpate the lymph nodes. Okay, right here we have the auricular. Then we have down here the posterior auricular, the occipital. None of them have been enlarged to this point. Okay. Then we have the superficial cervical. Then we're going to go ahead and go to the, you could extend a little bit, submandibular right here. None of them are enlarged. Submental right here. And then we're going to go to posterior cervical, which would be back here. No. And then subclavicular, which would be back here. No. There's no enlargement in any of those. Okay. I'm going to auscultate the carotid artery with the bell of the stethoscope. Clean my stethoscope with some alcohol. Okay, if you could hold your breath. Very good. Okay, now I'm going to go ahead and examine the heart. Okay, go back for me. Thank you. Okay. I'm going to start with the aortic valve, which should be right here. Then I'm going to go ahead to the pulmonic, then the Erb's point, and then I'm going to do the tricuspid valve, or the area, and the mitral. Very good. Okay, at this point, what I'll be doing is I will be, the S1 would be heard at the apex, so it would be heard in this area right here. And the S2 would be heard at the base, so it would be heard around the aortic area. Okay? Now, also the S3 and S4, when you auscultate it with the bell, and it's usually heard when on the left side, and the S3 and S4, it's heard with the bell, and it's heard at the apex, I'm sorry. Then we're gonna go ahead and we're gonna inspect the chest and lungs, palpate, percuss, and auscultate. Okay, so we're gonna start by percussing. Okay, now I'll be percussing the lungs. So I'm gonna go ahead and start with the shoulders. I'm checking to see if I hear any dullness. Okay, now I'm gonna go ahead and start with the right lung. And I'm comparing both sides. I'm going to do the lateral aspect. Okay. And I'm going to go ahead and check for percussive CVA, and this is to assess for pyelonephritis. So I'm going to go ahead and find the area where the kidneys are, and I'm going to ask them when I go ahead and do it if they feel pain. Okay? You feel pain?
No.
Feel pain?
No.
All right, and I'm going to auscultate the lung fields, the posterior first, and then I'll go ahead and do the anterior. Okay? Breathe in. Okay, oh, through your mouth. Okay? Breathe in. Okay, very good. Breathe in. Breathe in. Breathe in. Tell me if you get dizzy. Breathe in. Very good. Breathe in. Breathe in. Breathe in. Breathe in. Laterally. Go ahead. Breathe in. Breathe in. Okay, I'm gonna check to see that inspect the lungs and make sure that they're symmetrical when she breathes, which they are. Okay, and I'll be checking like this. If you could go ahead and breathe for me. Okay, very good. And I'm gonna check for tactile fremitus. I'm gonna ask her to repeat the number 99 for me. Say 99. 99. Okay. Very good. Okay, now I'm going to go ahead and auscultate her anterior lung sounds. So if you could turn around for me really quick. Thank you. Okay. Okay. Breathe in. Open mouth. Breathe in. Breathe in. Breathe in. Very good. Breathe in. Are you getting dizzy? Okay. Breathe in. Breathe in. Breathe in. Breathe in. And breathe in. Very good. Okay. Now I'm gonna go ahead and ask her to stand up for me. We're gonna go ahead and do the assessment on the abdomen, but due to the fact that it's easier to see when she's standing, I'm gonna leave her standing. Okay. We're gonna expose only the area that's being examined, and we're gonna inspect the abdomen, which would be inspect, auscultate, percuss, and palpate. Okay. So I'm inspecting the abdomen, and it's fine. It's symmetrical. There's no bulges. There's no striae. There's no visible peristalsis visible. Okay. And I'm gonna go ahead and auscultate, starting with the right lower quadrant. Very good. Now, okay, while I was listening to bowel sounds, I needed to make sure it was between 5 and 32 sounds. If it's not, it would be considered hypoactive, and I would have to listen to it at least 1 minute to consider it hypoactive. Now I'll be auscultating first vascular sounds of the aortic, renal, and iliac, and femoral, okay? And while I'm doing this, I'm going to be using the bell of the stethoscope. So I'm going to go ahead and find the aortic, okay? Then the left renal artery, the right renal artery, then the iliac, and the femoral would be here, okay? If I do hear anything, it would be due to stenosis, okay? So that's something that we would have to worry about, and we would have to let the doctor know, okay? All right, now I'm gonna go ahead and percuss the abdomen area. And this is to check where the liver is, if there's any masses or anything that we should worry about, okay? Okay. And I'm gonna go ahead and percuss for the lower liver border. Okay, so okay, it would be right here. You could hear the difference. Okay. And I'm gonna go ahead and palpate all areas, starting with light palpation and then deep palpation, okay? And it's just to see if we feel any masses. Okay, and then deep palpation. If you feel any pain or anything, this is to check if there's any muscle guarding, rigidity to the abdomen that we need to be aware of. Okay. Very good. Okay, I'm going to be palpating the spleen. Again, it's easier to do when she's lying down, but for the effects of the video, we're going to go ahead and keep her standing up. I'm going to go ahead and by the rib cage. Okay, right here. And then also to palpate the spleen, we would, if she was laying down, we'd grab her by here. And we're going to go ahead, it's right here. Okay? And we would see if there's any enlargement, okay? To see if there's any hepatomegaly or splenomegaly. Okay? I'm also going to palpate the right and left kidney and palpate the oral aorta. The aorta is right here. And then the left kidney, which would be a little 1 inch higher than the right kidney. Right here. Okay. And now we're going to start with the neural assessment, okay? Okay, so she's sitting up. We're going to go ahead and have her rotate her head with resistance. So I'm going to ask her to turn her head. Go ahead, turn your head to your right. And I'm providing resistance, and she's able to. Now on the other side. And I'm checking frame number 11. Very good. Now I'm going to ask her to shrug her shoulders. And now, go ahead, put it down. I'm going to ask her to do it again, and I'm going to add some resistance to it. Okay, very good. And we're going to go ahead and ask her to do the upper extremity fine motor movement and coordination. So I'm going to ask you to please, with your hands, I'm going to ask you to pat your knees and alternating patting your knees face down and then face up. And ask her to do it quicker. And this is in order to check to see if she has fine motor movement. And then we're gonna ask her to do the finger to thumb test, which is basically she's gonna go from the thumb to each finger. Go ahead and ask her to do it as fast as she can. Okay, now we're gonna ask her to do okay. Now we're gonna ask her to put her finger to my finger and then touch her nose. Oh no.
Not good.
Have you had any drinks, ma'am? Okay. Okay. Very good. One more time. Let's make sure. Very good. Okay. Okay. Now I'm gonna ask her to straighten out your legs. This would be laying down. Okay. We're gonna try to improvise here. I need you to put your foot from your knee to your ankle. Very good. Slide it. Make sure it's in a straight line with the other foot. Very good. Okay. Very good. Her gross motor movement is also intact. And then we're gonna be seconds, please. Okay, now I'm gonna be checking her bicep reflex. I don't have a reflex hammer, so I'll just be letting you know how it's done. Okay, I'm gonna ask her to extend her form like this, and I'm gonna be holding it. And I'm gonna have the reflex hammer, and I'm gonna go ahead and hit my thumb, and the normal response would be for it to jerk up slightly. Okay? Now I'm gonna go ahead and go to the next one, which would be the patellar reflex. Again, I don't have a reflex hammer, but the way it would work is you would find the bottom of the patellar, you would find the tendon, and you would go ahead and hit it, and the knee should jerk up, the leg should jerk up. And then the Achilles reflex would be basically, we would hold the foot out and we would go ahead and with the reflex hammer hit the tendon, Achilles tendon, and it would also jerk. Okay? Now we're gonna assess the position sense of the great toe bilaterally. Okay. Let me see your toes. Okay. Her toes are symmetrical, they're bilateral, they're facing forward, and we would do the vibratory sense, which is basically you would put the tuning fork on the great toe where there's bony prominence. You would hit the tuning fork to the heel of your hand and place it on the bony prominence, and she should be able to let me know when she feels it vibrate and when she feels it stop. Okay? And then I'm going to ask her to stand up for me. And I need you to stand up straight with your arms to your side. And then I'm going to ask her to close your eyes and hold the position for 20 seconds. Okay. And at this point, I would be trying to assist her if she starts swaying or about to fall. And then I'm going to ask her to walk in a straight line from heel to toe walking. Like, walk regular, but I need you to do it heel to toe. Heel to toe. Go like this. Very good. And so I assessed her gait, and I'm going to wash my hands, and I'm going to document, and we're done. Thank you so much.